Hey Mark, how you feeling?
I'm good. How are you?
I'm doing good. I just wanted to touch base with you. I know that you've been dealing with some back pain, right? And I know it's been bothering you for a little while now. The main thing I wanted to tell you is we got your report back. So I think we have a pretty good idea of what's going on,
Okay.
right? I have your x-rays right here, and if you look, you can see that's the lower part of your back. This is what we call the lumbar spine, right? And so it's right here in that low back. And we're seeing that there's part of your bone in your spine that's a little bit slipped forward.
Yeah, I see it.
Right.
Wow.
And so with that can create a lot of pressure and a lot of discomfort, especially not just in your lower back, but on the nerves that are releasing from that area. Okay?
Okay.
This is also kind of explaining some of the symptoms that you've been showing, right? That decreased sensation over in your leg, as well as a lot of that burning and that dull, achy feeling that you're feeling in the back, right?
Okay.
The good thing is chiropractic definitely is a good treatment for this, right? Be able to do some manual adjustments using our hands, which would help put that bone back into place, right? Now with the chiropractic adjustment, there are some risks involved, just like how right now your back being in pain because of the slippage, us trying to put that back into place could cause a little bit of tenderness, soreness, right? And on rare occasions, sometimes even strains, right? I always want to make sure our patients are aware of any of the risks involved. On the more extreme cases, the more extreme risks could be things such as fractures, dislocations, or even punctures, right? But good thing is, by looking at your x-rays, we're able to kind of determine if you have any of those red flags that we need to be aware of. And it looks like you are a perfect candidate to be able to receive chiropractic treatment. But I just want to make sure that you're aware that sometimes with every profession, there are some risks that may be involved,
Yeah. Okay.
right? We will be also doing some adjustments just over in the cervical area, right? We're going to try to take care of your entire spine. On very rare occasions, we have seen things, like I said, with fractures and soreness, but also there is a risk of stroke. This is about 1 in 100,000, right? So when I tell you that this is a rare occasion, it is a very rare occasion, but I always want to make sure that we have informed consent and that we're at least on the same page before we begin treatment, okay? If you feel anything out of comfort or feel anything that may be painful or have questions about, please bring them to me so that way we can modify, or I can let you know exactly what's going on.
Yeah, sounds good.
Perfect. Some other things I'm going to have you be doing with me is we're going to be doing a couple of therapeutic exercises. I know you've heard of planks, right? The planks just trying to work on that core. We're going to have a couple of exercises that are very similar to that. And the goal about this is to try to increase your abdominal strength to be able to support that lower back. We don't want your lower back having to take on too much, so we're going to just try to strengthen the other opposing areas so that way we can give some relief to that back, right? Also improving your function.
Gotcha.
Okay. I saw in your history that your family has dealt with back pain as well. So the thing that we're going to be doing is we're going to be trying to monitor your posture, and the exercises are going to help with that also.
Okay.
Right? You being an accountant, you're really sitting down. It's kind of more of a sedentary job. We want to make sure that we're doing things outside of that that are going to just help you strengthen and keep that functionality even outside of work.
Okay.
All right. Also, I see that you're taking pain medicine as well as medication for your high blood pressure. That's totally fine. Just let me know if there's any changes in your medication, right? So that way we can adjust accordingly. We'll always be checking on your blood pressure, making sure that everything's okay and within normal limits, and just making sure you get the best treatment as possible, okay?
Yeah, thank you.
Perfect.
Sounds good.
Of course. Lastly, I'm just going to tell you, if this treatment were not to work, right? Or if you were to feel like it's just something that you might want to consider elsewhere, I'm happy to help. Not only help you with this treatment, but help you find the providers that you may need, even if it's surgery, hospitalization, or other therapies, okay? So regardless if it's with me or with somebody else, we're gonna make sure that we get you to the proper people to make sure that you're feeling better, okay?
Yeah. Okay. Yeah.
Perfect. So the way that we're gonna be doing this is I wanna see you about 3 times a week for the next 2 weeks, okay? The reason I want to do this is I just want to make sure that these adjustments as well as the exercises are helping not only decrease your pain, but improve your function, right? If we're able to see within the next 2 weeks the improvement, then we'll potentially get it to about 6 to 8 weeks,
Okay.
right? No more than 18 sessions, so about 6 weeks in total right there, maybe 8. But the goal of that that is to make sure that we're decreasing your pain by roughly 70 to 80%, as well as improving your function, right? If we're able to do that, I will give you the option of going an additional couple weeks, bringing it up to 24, or actually 12 weeks. With 12 weeks, the main goal with that is just to make sure once we get you out of pain in those first 6 to 8 weeks, the next 4 weeks we're trying to maintain that. Maintain and build that strength so that way you can continue on with your life and you don't regress, alright? But that's something that we'll be able to talk about after we reassess to make sure that the treatment and everything's working, okay?
Okay.
Perfect.
Yeah.
Is there any other questions that you might have for me?
I think, no, that's good, yeah. Thank you.
No problem. Alright, so what I'm gonna do is I'm gonna bring it up to my CA up in the front. I'll talk about the next time that we're gonna have you in, what time, and we'll get payments ready, okay?
Great. Yeah.
Perfect. Follow you, Mark.